Does your child have a sore throat, a runny nose, a cough, and is generally tired? They may have a cold. Most colds get better in 5 to 7 days. However, some can take up to 2 weeks to get better. Having up to 11 colds a year is nothing to worry about as long as your child is drinking and breathing normally. Make sure to keep your child hydrated and wash their hands regularly. You can give your children paracetamol and/or ibuprofen to help with their fever, pain, or discomfort. You can also use nose drops if their nose is blocked. Go to your GP if your child has had a sore throat for more than 4 days, your child's temperature is very, very high, your child has had a cough for more than 2 weeks, or if your child is consistently getting worse. Remember, no antibiotics if it's a virus. Call 999 or go to A&E if your child is finding it hard to breathe or is unable to swallow fluids or saliva.